Hello, and welcome to this clinical vignette presentation on a case of Ewing sarcoma presenting to the primary care office as Melena. Ewing sarcoma is traditionally thought to be a tumor of bone comprised of highly malignant neuroectodermal small cells. However, in approximately 20 to 30% of cases, Ewing sarcomas can actually present in tissues other than bone known as extraskeletal Ewing sarcomas. Here, we'll discuss one of these cases of extraskeletal Ewing sarcomas that developed in the small bowel and was discovered following a capsule endoscopy turned small bowel obstruction. The patient is a 66-year-old man with a past medical history of perforated diverticulitis that required a hemicolectomy with colostomy formation and reversal that was 10 years prior to his presentation to the primary care office for this complaint. The patient was otherwise asymptomatic and only noted the dark stools that he wanted evaluated. Initial workup was significant for a hemoglobin of 10.0, which was down from 15.7 4 months prior. This was a macrocytic anemia at the time, and other studies were significant for an interestingly negative fecal occult blood test and an iron profile consistent with iron deficiency anemia. The patient was then evaluated by gastroenterology and decided to proceed with an upper and lower endoscopy, which found only gastritis and no active source of bleeding to explain the patient's symptoms. Over the next several months, the patient continued to be monitored, and the anemia failed to completely resolve and ultimately turned into a microcytic anemia. A repeat fecal occult blood test ended up being positive, and at that point the decision was made to proceed with capsule endoscopy. Capsule endoscopy also failed to identify an active source of bleeding. However, prolonged small bowel transit time was noted. Additionally, the patient never noticed that the capsule had passed, and 4 days after ingesting the capsule began developing abdominal pain. This abdominal pain would progressively worsen over the following 4 days, and ultimately the patient would present to the emergency department. Imaging in the ER showed the retained foreign body in addition to changes concerning for small bowel obstruction proximal to the foreign body. General surgery service was consulted and ultimately decided to pursue an exploratory laparotomy, at which point the involved bowel was densely adherent to the ostomy closure site involving the posterior rectus fascia consistent with bowel loop included within the suture closure of the fascia. The involved bowel was ischemic and a severe site of obstruction was noted, and the non-viable bowel was resected with surgical pathology following, showing involvement by a round blue cell tumor with various stainings consistent with Ewing sarcoma. The patient was then referred to a comprehensive cancer center for further management, where he was followed with surveillance CT scans over the next several years and remains without evidence of recurrent disease 4 years later, which is at the time of this report. This patient's case is a classic example of obscure gastrointestinal bleeding, which is defined as bleeding from an unidentified source after an upper and lower endoscopy. These are typically the result of small bowel pathology, distal small bowel, and require extended enteroscopy or capsule endoscopy in order to directly examine this portion of the intestinal tract. Due to its rarity, extraskeletal Ewing sarcoma currently lacks explicit treatment guidelines. However, it is our hope that as more cases are discovered and managed, that there will be some sort of consensus arising on how to best manage these patients. We believe that our patient's case highlights the importance of persistent investigation of iron deficiency anemia secondary to suspected obscure gastrointestinal bleeding with direct examination of the distal small bowel. While our intent in using the capsule endoscopy certainly was not to cause a small bowel obstruction, it was ultimately this that led to the patient's diagnosis of a neoplasm and led to a relatively early resection, ideally leading to a decrease in this patient's morbidity and mortality that we think can be applied to others. Thank you for your time.